You've been in the meditation world long enough. There's certain words that, like, to the outside, sort of civilians sound like normal words, but they're not. They're like super loaded. And like distraction is one of those words. Distraction is like, it's almost as bad as like sin,
Right.
right?
Right.
And so, like, people have learned, like, in the trauma-informed meditation world, they actually have renamed it distraction because people have such a bad reaction to that word and call it like behavioral compassion or like that, like you're, or like just external focus, like I'm going to
Right.
deliberately like focus on something external. It's not distraction, like I know what I'm doing. But like, focusing on your body is going to amplify the bodily signal, and focusing outside of the body is going to have the opposite effect. And so if you're having like a huge reaction, positive or negative, you focus on the body, that's going to get louder. And
Right.
that's a really good way to sort of like blow up your circuits. And I see that all the time, like in both positive and negative directions. People go on retreats and just continually like upregulate their system, and they're focusing on their body, and so that's amplifying, and it just kind of is this feedback loop to the point where they either have a panic attack or they have a panic attack and then they dissociate, or they have like, a euphoric unity experience, which is also too much for the system. And then they dissociate and they wake up in the morning and they're like, that was awesome, but now I feel nothing. So it's like it can show up in a lot of different ways.
Welcome to Living Mirrors with Dr. James Cook. My guest this week is Willoughby Britton. Willoughby is a clinical psychologist, associate professor of psychiatry and human behavior at Brown University Medical School, and the director of the clinical and affective neuroscience laboratory there. Her lab researches the psychophysiological and neurocognitive effects of meditation and mindfulness-based interventions for mood and anxiety disorders, with a particular focus on the potential risks of meditation practice. She's also the founder of Cheetah House, a non-profit organization that provides evidence-based information and support for meditators in distress, as well as meditation safety trainings to providers and organizations. Today, we discuss the potential adverse effects of meditation and how to meditate safely. Hope you enjoy the conversation. Okay, I'm here with Willoughby Britton. Willoughby, thanks for coming on the podcast.
Thanks for having me.
Yeah, I'm excited to talk to you today. The work you're doing on kind of meditation-related challenges, I think is really important. And maybe I'll start with a bit about where I'm coming from, because I feel like in this space, your work is kind of surprisingly kind of controversial. There are people who kind of push back against it. So yeah, it might be interesting to share where I'm coming from. So I didn't come to this stuff as a meditator. I had a kind of spontaneous mystical experience as a teenager that kind of introduced me to this terrain. And then for me, orienting to my experience was one of kind of trauma healing and empowering myself to navigate through my experience. So for me, my passion about this stuff is entirely about empowering people to navigate their experience. So when someone says meditation, that's kind of what I have in my mind. Yet at a kind of sociological level, there seems to be this phenomenon where people who approach this stuff on a more gradual path, my instinct is that there are people who it just kind of works for, and then they become kind of passionate about it and they evangelize about it. And then there are people who, and I think I would have been in this category if I didn't have this spontaneous experience, who have trauma and sit down to face their experience, find it very triggering. Perhaps there's kind of shame and all of this kind of just unpleasant emotional stuff coming up. And then there's just this kind of assessment of, okay, this isn't for me. I don't like this. Or even they go a bit further and then they start having difficult experiences, but they're not being guided in a trauma-informed way. So we have this split where there's people who are really passionate about meditation who it worked for in a non-trauma-informed way. And then there are people who are just kind of alienated from it, or again, who start on the path and then have difficult experiences as you've documented. So that's where I'm coming from as to how I see this kind of the terrain in which controversy might emerge around people being resistant to documenting challenges in these experiences, which because I think the analysis is necessary, because it's kind of a strange phenomenon to me. I feel like we should all be on the page that you're coming from of trying to kind of document and make sure people are safe in doing this stuff. So sorry for the long preamble, but I thought that would set us up and see where you want to go from there.
Yeah, that's great. And I think I share, you know, the same intention, which is to empower people to navigate their experiences, from their own, with a lot of agency and a lot of autonomy, and a lot of empowerment to do that. And that sounds like a very simple wish, but it's actually pretty complicated when you like actually start to put it into action. So,
Right. Yeah, and that's why it's useful to have the very thorough documentation that you've performed and kind of charting the challenges people come up against that we're going to look at. But I wonder if you could speak a bit more to the kind of mindfulness evangelism that the factions of people who don't want to hear the message that you're putting out there, because I think there are people who are sincerely passionate about it, which I'm probably in the camp that I think that orienting to your experience in the present moment is a kind of master trait that instead of just kind of turning away and habitually being lost in addiction, kind of addictive patterns, I do think it's incredibly powerful. So I'm kind of in that camp to some extent. But then there's also kind of corporate interests and just there's a lot of factors at play, I think, that lead to a less than nuanced conversation taking place.
yeah, I mean, I think, my training is so I'm a clinical psychologist. And so I was trained in treatment research. And so the questions of, treatment moderators, what treatments work for who and why, um, in terms of meditation, practice specific effects, like individual differences, and adverse effects, those are all just givens as like part of treatment research. And so, so when mindfulness comes on the scene as like another treatment, it's being treated by like just like every other treatment, and all of those things are research questions that we ask as part of just like standard process of science and treatment evaluation. And then there's this like strange reaction, right, from like certain people. And that's like in itself like super interesting. Like, why are people getting so upset about just like they don't get upset when when meditation is being treated like a medical treatment. They're like, oh yeah, it's a medical treatment, it's better than medications, like, but like when it was like, okay, if it's going to be a medical treatment, then it needs to go through like all the same hoops as other medical treatments, which is like, safety and feasibility and like, individual differences and moderated treatment outcome, like all the things. It's like, this is not a big
Yeah.
deal. This is not controversial. And
Yeah, and I think
so,
sorry.
so like to see that, so I've gotten really interested in like this like asymmetrical reaction to this research. And, you know, I have found that, there is a certain, I mean, you also have to think about where meditation is in terms of its like sort of categorization. It's hanging out between a couple categories. And so like, is it a medical treatment or is it a religion? Or is it wellness in this like mushy world of wellness? And so I think that that's, part of it. And that like, if people can't like have a very strong reaction to any kind of criticism or any kind of like there might be some limitations to this thing. There might be some places where like the claims do not apply to all people. Like when people get upset about that, then like that's behaving more like a religion than it is like a medical treatment.
Yeah.
Which I think is like wouldn't be that surprising to a lot of people. We're like, yeah, meditation is part of, kind of religious. Well, it is definitely part of a religious system. It's just that we don't think of it necessarily operating that way in the West. So
Right.
anyway, those are just some of my thoughts about some of
Yeah.
those reactions.
Yeah. I think this is a phenomenon in kind of spiritual spaces where because the general kind of project of spirituality is about opening up and letting go of attachments, I think there's this paradoxical or just this kind of counterbalancing that happens where people really attach very firmly to whatever it is that they feel is their kind of lifeline that they're holding on to, whether it's their particular technique or their particular metaphysical picture. You see this very kind of ferocious kind of holding on to certain things. So I think that could go some way to accounting for why, yeah, there can be a lot of pushback. But also, yeah, I mean, you made I think something that's going to keep coming back in trying to understand how to make sense of this area is this tension between meditation being a kind of spiritual practice, something that's kind of getting a kind of existential circumstance that's deeper than biomedical science, and then it being imported into kind of biomedical science as a treatment. And so, as I think, if we have those two things operating, someone who's totally passionate and says about kind of this as something, yeah, more fundamental, deeper than treatments and medicine, that's one way to talk about this. But if you're then going to talk on the level, as you say, of saying we are calling this a medical treatment now, we're saying it's supported by clinical science, we're going to advertise our meditation apps using that language, then you also need to do the other side of it, right? The kind of due diligence of checking the risks and making sure that it's safe.
Right.
Yeah. And you have quite an extensive meditation background, right? Just so people know that you're not coming at this as someone who's kind of, in any way experienced with this stuff.
Yeah, I started meditating in 1995. And basically as a result of, a life crisis, like most people. And did a lot of practice in, Western Insight, Theravada kind of traditions. I would say probably 15 years in that tradition, and then the other sampled a lot of other ones, since then. But I stopped counting. I was in a couple of meditation studies, like as a, the advanced meditator. And so I had to count my hours for those studies. And so like in 2008, I had like 10,000 hours, and I was like, okay, that's enough.
Yeah. You're in the expert category. And yeah, so the framework that you are coming from, right? I'm hearing you say in an interview that you were given a book by Jack Cornfield, and in that kind of Theravada framework, it was being presented that a kind of calm state of mind was the target. And this is very much, one of the top apps is even called Calm. This whole idea that it's kind of good for sleep, and it's all about relaxation, which can be part of it, but it's far from the whole picture of what's going on. So maybe that's a good way into the first study that you did on the effects on sleep.
Yeah, so that was my dissertation study, and this is about 10, well, almost 10 years into my practice at this point. And I had already been trained as a mindfulness teacher, so mindfulness-based cognitive therapy teacher. So, and I was pretty, evangelistic about like my promoting meditation with science. And so I decided to study how meditation, it would be mindfulness-based cognitive therapy specifically, impacted sleep as measured by brainwaves. And, I was excited to be kind of one of the first people to show that meditation was good for sleep, correctly measured. And so, fast forward like 3 years and not 200 nights of staying up all night watching people sleep, the data did not support the hypothesis that meditation was relaxing and sleep promoting. In fact, it was more complicated than that. I mean, in a linear sense, the more people meditated, the more awake or aroused their brains became. And so, there's lots of different ways of measuring that. So you can look at fast wave activity. So there was less fast wave activity. There was more fast wave activity, less slow wave activity, more awakenings, more arousals, like at night. And each one of those cortical arousal indices was correlated with the amount of practice that the person had. So like kind of no way around it was, the data suggested that meditation dose is associated with increased cortical arousal. At the same time, if you look at the lower doses, so people who are meditating less than half an hour a day, they did actually have sleep promoting effects. And so a lot of the, hype or like positive ideas about meditation like might be true under certain circumstances, but it's not universal, and it's not, like there's going to be certain conditions where it's true. And so half an hour a day is like really not that much. So, when people come and they're starting to like maybe tip into sort of anxiety, That's the first thing to try is just see what happens if you just practice a little less.
Right. Yeah, because I think for people beginning in meditation, maybe some people will try 10 minutes a day, if they're really just starting. But then one of the common frameworks to go through is the Goenka Vipassana stuff, which is 10-day silent retreats, recommend 2 hours a day sitting. And that's like from the start, which in the context of what you're saying feels like quite a hefty dose to begin with.
Yeah, I mean, I think now that there's trauma-informed practices that are pretty well, like the principles of that are pretty well developed, that if people had a mental health condition or they're just concerned about, meditation related adverse effects, like just ease into it. Like, you wouldn't run a marathon like without training. Like, so, you can do a 1 day and then a two, and then just work your way up to 10 days and then do your Goenka retreat.
Yeah. Yeah. Also, I think I would say to people not to underestimate the way that if you're a high functioning person with trauma and you don't know that you have trauma, the way that it can be repressed so that you genuinely don't have a kind of intuition that you have it there. And so you could think, oh, that's definitely not me, but it may be you, that there's something that could come up on a retreat or in any situation. So I think it's worth anyone being informed in the trauma informed principles. And maybe you could say a bit about how people practice trauma informed mindfulness these days.
Yeah, so I mean, the term trauma informed or trauma sensitive has been kind of popularized by David Treleaven, and he wrote a book called Trauma Sensitive Mindfulness. I mean, I tend to take that broader and to use the term just diversity informed, meditation or mindfulness, because it's to me like we're seeing people develop problems who really don't have a trauma history, and it's not
Mm.
hidden. They just don't have one, and they don't have a psych history either. So like it's more just about individual differences, in the most broad sense possible. Trauma might be one of those differences, but it could be a lot of different things. So so I just call it, just respect for individual differences and just knowing, like very similar to like yoga practice. If you did yoga like 20 years ago, you would go in and they'd be like, this is the pose. This is the correct way to do it. And like eventually you'll get there, and that's like the way it was taught. And now it's like, well, here's like 10 different variations of this pose. And like some people have tight hips and some people have, different shaped shoulders, and like they have to do different variations. And there's not so much of this like there's one right way and like there's one right pose. It's like, no, there's lots of variations because people are different. So I think that's the flavor of, giving people different choices, giving people just honoring the fact that people are going to have different reactions to it and not trying to squeeze them into any particular mold of the teacher or the lineage.
Right.
Those are the sort of basic ideas. And I think that yoga is way ahead of meditation for whatever reason.
So I think normalizing that kind of empowerment, is really fundamental. And we're going to talk about the complexities of the different challenges people face, but it does seem to me that they all, would you agree, they all come under this broad category of kind of destabilization that could be avoided potentially if there was attention paid to kind of titration within one's kind of window of tolerance, that so someone feels like they're really in the driver's seat, and that if they have some awareness that when things are starting to get out of control, even before it gets out of control, they can navigate. Do you think that's the kind of central mechanism that when that's not engaged tips people over into these different kinds of experiences?
I mean, does tend to be the way that I do a lot of teacher training and, recommend that if people start to learn their own, what I call them indicator lights, like you have on your car, like this light lights up when you're out of gas and this one lights up when your engine's overheating. Like we all have our own indicator lights. Like when you're hungry, like what does it look like? When you're stressed, when you've had too much, whatever. So, we all have our own indicator lights, and some of them are similar. Like we all have increased heart rates at some point. But sometimes we have really, really specific and unique ones. And so like really spending using your mindfulness practice to like really get to know what those are and then communicating those with the teacher. That's worth like a class, just one class, like getting to know that. And then like you're like, okay, like now you know what your indicator lights are. And now you can apply that like within any practice that we do. Like if any of those lights start blinking, it's like, okay, like time to pause and like see, consult with the teacher or just like, back off. But that first step is often missed.
Yeah. Yeah. I think early on in the conversation, I said how I think this ability to orient towards the present and not be lost in distraction is a kind of very powerful thing. And I think the way it's taught, meditation gets taught as well. We're doing this orienting towards the present thing now, and so just if anything's going wrong, just keep doing that. Like distraction is bad. Like being distracted and unconscious is bad. So just keep drilling down. Whereas my instinct is it's okay to have to consciously oscillate between these. So if you're getting overwhelmed, it's okay to get up, move your body, go distract yourself with something. That's not the same thing as just being lost in unconscious thought and having no awareness. You're intentionally deciding I'm going to regulate my body by kind of turning away from my inner world and
But I mean,
recruiting.
if you've been in the meditation world long enough, there's certain words that like to the outside sort of civilians sound like normal words, but they're not. They're like super loaded. And like distraction is one of those words. Distraction is like it's almost as bad as like sin,
Right.
right?
Right.
And so like people have learned like in the trauma informed meditation world, they actually have renamed it distraction because people have such a bad reaction to that word and call it like behavioral compassion or like that like you're or like just external focus. Like I'm going to
Right.
deliberately like focus on something external. It's not distraction. Like I know what I'm doing. But like, focusing on your body is going to amplify the bodily signal. And, focusing outside of the body is going to have the opposite effect. And so if you're having like a huge reaction, positive or negative, you focus on the body, that's going to get louder. And
Right.
that's a really good way to sort of like blow up your circuits. And I see that all the time, like in both positive and negative directions. People go on retreats and just continually like upregulate their system and they're focusing on their body and so that's amplifying and it just kind of is this feedback loop to the point where they either have a panic attack or they have a panic attack and then they dissociate or they have like a euphoric unity experience which is also too much for the system and then they dissociate and they wake up in the morning and they're like that was awesome but now I feel nothing so it's like it can show up in a lot of different ways.
Right. Yeah, it was in David Treleaven's Trauma Sensitive Mindfulness book that I first came across this idea of using different anchors. I think is the word he uses for of attention, and it doesn't just have to be the breath. It can be an external object, a sound, a visual object. Sensation in your hands, feet. I think you did a study, right, looking at the effect of these different anchors.
Yeah, so we did a study. This was a larger study, which where this was a practice specific effects dismantling study. So we had mindfulness-based cognitive therapy, which is a combination of focused attention and open monitoring. And so that was the combo. And then we had focused attention, only that for 8 weeks, and then only open monitoring for 8 weeks. And so within the focused attention condition, we expanded the number of anchors to be six, three breath anchors and three non-breath anchors. And so we had breath in the nose, in the chest, and then in the belly, hands, feet, and sound. And we asked people to choose an anchor and, kind of like try them all, but then like choose one that's like sort of their favorite and then have one backup. That's like sort of the second favorite. And what was interesting was that when given the choice, more than half of the people chose non-breath anchors, which is super interesting because the breath is the one that you just get. It's like, here, you're going to do meditation, like you're going to focus on your breath, and we don't even give you a choice. And so that finding has also been replicated by another study. So it's a pretty robust finding that people like that for many people, the breath is not neutral. And when we ask them, why did you not want to do the breath. They said that it like, it could increase anxiety. So I think that's just offering, this is a very, very good example of like, you could just give people, the program that I was trained in, mindfulness-based stress reduction, mindfulness-based cognitive therapy. We have a breath awareness practice that's pretty central to the practice, but we basically took that and made it into, we call it 6 anchors now. And so like you just give people the option and you just go through each one and you can basically give them the same exact recording and they just like when you say the anchor, like they just decide on which one they wanted. It's like a pretty easy fix.
Right.
And
Yeah.
you just multiplied the likelihood that the person's going to find, you know, a a really good solid anchor. You just multiplied that likelihood by 6. So
Right. Yeah. And if you're attached to the breath being particularly important, then they could gradually approach that over time in a way that's empowered. If it becomes triggering, they don't just have to deal with that. And I think in the study, there was a correlation between trauma history and the breath being anxiety inducing. Is that right?
right. So people, yeah. So people who did not who chose non-breath anchors tended to have
Right.
a higher trauma history. Yeah.
Right. Which makes sense. Yeah. So kind of just to unpack that for people that it makes sense, right? That if you're in a kind of, if you have an experience that triggers fight, flight, freeze responses, your breath is absolutely central to your physiological response there, right? So any stressful memory is kind of somehow linked to breathing. So it totally makes sense. And it's even,
Well, and that as well, like, I mean, if you think about where really any emotion is going to reside,
right,
especially like anxiety, like it's going to be located primarily between like your chin and your waist and mostly in the midline. Like you don't tend to have like anxiety like on your sides, definitely not in your hands and feet, right? So it's like there's a very like, in your torso in the midline. And that's what people found was like even the breath anchor at the nose was less problematic than the ones that were in the middle, like the chest and the belly. So it's your viscera
right,
that tends to be, more problematic for people. But it's also one of those things that like there are plenty of people, pretty much every rule that I'll spit out, there'll be an exception. Like, somebody um who had a trauma history like loves the breath, and another person who had a trauma history who was doing doing hands as their focus ended up like the particular recording of going through the hands like triggered a flashback. So I think you just really have to be just listening to each person's experience
right.
specifically.
Yeah, I mean, and again, that the idea of them being in the driver's seat, you don't have to overcomplicate things and figure out in advance how to guide them through it. Just tell them, do what feels right to you. Trust your own inner compass, right, to kind of navigate towards what feels right.
Right.
And it's strange that, we focus so much on the breath, right? Because in traditional Buddhist practice, there's lots of different anchors you can choose. People practicing with flames and kind of discs of color.
Right.
And so there's nothing kind of that means that the breath is special. I mean, the breath is kind of interesting that you always have it with you and you can engage with you can breathe intentionally or automatically. But so, there are some pluses, but it shouldn't impede someone from ever picking up a mindfulness practice if they find the breath challenging to work with.
Well, and similarly, I think that, the commodification process of meditation into mindfulness being this kind of like one thing and then having it try to address every possible like
Right.
you know human condition possible is like that's a tall order for any practice. And so there are lots and lots of contemplative practices. They have different effects. And I think a lot of the problems that I tend to see are from a mismatch between the meditators, what their goal is and what practice they're doing.
Right. Yeah. And I think that's another important thing to focus on when it comes to the way people interpret these findings, because if someone's signing up again to feel calm or to have certain as a kind of treatment, say for their anxiety or something like that, and then they have these experiences, that's one thing. And then if someone is their goal is actually something very radical about changing the nature of experience in, in like a Buddhist framework, where they're really trying to get to radically different states of consciousness, then the same phenomena could be read in entirely different lights depending on those values, those frameworks of values, right? So I think when you read through the effects you document, they can be read as symptoms, as kind of negative, challenging experiences, or if you're looking at it through the lens of kind of certain kind of Buddhist philosophical traditions, you could say, oh, great, these people are achieving the things they're supposed to be achieving, right? So something like, if is feeling, is it equanimity or is it anhedonia when you don't have big fluctuations in positive and negative feeling,
Right. I mean, I think so. So there's a range of experiences, and the experiences are fairly reliable in terms of what gets produced. But the interpretations, right, and the impacts of those experiences was varying widely, and I think in the varieties of contemplative experience study, we documented 59 different potentially challenging effects, but there wasn't a single one that was like universally, experienced as negative, except for maybe suicidality. Like generally speaking, that was usually thought of as like, okay, this is a problem, but not 100% of the time. And so we got really interested in, that process, like the process of appraisal, like what happens between, like you just threw it out there in like 2 seconds, maybe it's this, maybe it's that. And it's like, well, wait a second, like, what is this process of appraisal and like who's making it? And
right.
like, what are the consequences of choosing one versus another type of appraisal? And like, I think one of the other things that sort of come to light, and it's taken years for me to see this, is that who there's a tremendous amount of power in making that interpretation. And that often that interpretation of like what this experience is made by someone other than the meditator, which is also a little weird, or that the meditator doesn't even get a vote into saying what it is. And so I'm a person-centered therapist, so I'm like, I try to be like, hey, can the meditator get a vote here as to like what this thing is? Because one of the things I often see, and this is at the people that come to me at Cheetah House, is, they were sent on some meditation program by their therapist, like for stress, like something very secular and medically oriented. And then they go on a retreat and they start to have, experiences of either like anxiety or, feeling like just strange out of body or like floaty or changes in their sense of self. And then, they get told by the teacher, like that, this isn't actually a problem. This is actually a good thing, and it's like, so, basically that person's now does not get to decide whether this is a good thing or not. So that's like, there's so much going on in that like little interaction. And so, I want, for people that come to me, I want to like back up and be like, feel like I have to keep meditating because it's supposed to be a good thing. It's going to end well for me. And like, you get to decide whether this thing is, an adverse effect or not, or you get at least some input. So
Right.
anyway, we have a whole paper on, the impacts of worldview or appraisal, on, kind of the trajectories and outcomes of people with challenging
Yeah.
experiences.
Yeah, I think you've chosen a really fascinating intersection, being a person-centered therapist, working in paradigms that often are geared at moving beyond a sense of self. So like if the goal is to kind of experience states of consciousness beyond the personal, then you do get into this situation where, I guess the way that I would view it is, I think it's, especially in the early stages, it's really absolutely essential for people to build a sense of empowerment that they're in the driver's seat, they're navigating. But then I think when we're talking about very deep people, maybe they're monks and people who really want to kind of go the whole way. I think at a certain point, the sense of self almost is based around resistance, fear, doubt. And so like to move beyond it, there needs to be a kind of surrender into some kind of faith, some kind of trust in that people have walked this path before you and their guidance is worthwhile. But then that kind of gets collapsed into, well, just have faith in this arbitrary, whoever this teacher is that's in front of you right now, instead of saying, well, start with the empowerment, assess for yourself, think, is this person really who you want? Do you really believe in this framework? Be very, very conscious, and only then, move to this stage of kind of faith and surrender, I would say.
Well, and I would push back on the individual differences. Like for sure, that's a viable path for a lot of people. And there are lots of people where the surrender path is just not
Right.
is not the way.
It's not for everyone.
And if you're if there's a form of sort of systemic trauma, if you come from a marginalized kind of group that's systemically oppressed and you're being told that like, the way forward is to surrender to some authority, like that's not really the pattern of victory for them,
Right.
so it might look a little bit different.
Right.
Um,
Yeah.
so
And I think
that, yeah.
you found data on that as well, right? About marginalized groups being more affected by this kind of, I can't remember the specific finding, but we were looking at differences between different groups.
Yeah, so this was a paper that I wrote with Simon Goldberg and Richie Davidson. It was an epidemiological study on people who had meditated even once, and we did, the questions were based on a clinical scale, so they were assessed as negative. So it wasn't the appraisal was already there, and they got to decide, to what extent meditation had caused negative effects. And we found that, yeah, people with early trauma histories, low levels of income and or education, and people who had minority racial status or other marginalized groups were more likely to have higher rates of meditation-related adverse effects.
Right. And then there's this kind of phenomenon of institutional trauma, right? Where the kind of, it can happen in psychotherapeutic practice as well, where people feel disempowered or harmed through the techniques they're being given. And so you run this nonprofit, right, Cheetah House, and as part of the work you do, a kind of peer support model to help people recover from this kind of effects.
Yep. And I mean, the meditation effects, but also, the secondary, what we call, it's called institutional betrayal, or betrayal trauma. And that is often when someone in the helping profession, which could be a meditation teacher or a clinician or a university or like anyone that's supposed to be kind of your refuge or your ally, ends up being the source of harm. And there's a pretty much no matter who you are, there's a default response to claims of harm, which is going to be defensive. And so I mean, unless you're very, very aware of it tends to be everyone's default, which is, it wasn't the victim did something wrong, or they already had something wrong with them, or there's ways of victim blaming or deflecting responsibility, and so any of those moves are considered institutional betrayal and can be sort of extra devastating because we put like it's like being sexually abused by a parent or something like that. It's like you put so much of your physiological like trust into this person and this entity, and to be betrayed and violated by them like it's especially traumatizing. So that's I think there's other words for it. Sanctuary trauma, I think, is another
Mm.
term that's similar. So yeah, we work with that, and also just what we call ideological terrorism, which is just feeling terrorized by certain ideas. Yeah.
Right. And then there's a technique you call scaffolding, right, that you use to help people recover.
Yeah. So scaffolding comes from somatic experiencing trauma, therapy, and which I did the 3-year training in somatic experiencing and started using it with meditators. And then we eventually over years, we modified it enough because we found that a lot of times meditators had so much body awareness, like they had too much body awareness. And so somatic experiencing is sort of assuming that you're not a meditator and that you need more body awareness. And so we have de-emphasized the somatic piece. And so to call it resourcing, which is what they call it in somatic experiencing, was confusing people because they're like, I did resourcing with my somatic experiencing therapist, and it was like terrible, And I was like, okay, we should change the name. So scaffolding is the name that we use, and we use that based on a paper that was actually written by Joel Kruger, The Scaffolded Self, which is about how we use external objects are often, co-constituting our sense of self. And so for people that have gone through, a traumatic experience, and this can be meditation related or anything where their sense of self has been shattered or fragmented, being able to sort of stabilize it within a certain environment and being able to have, real concrete objects that you can hold that are not, imaginary, that can help really stabilize things. And so that's kind of the process. And you have to do it one-on-one with each person because everybody gets scaffolded by different things, and there's just no possible way to predict what is going to be sort of resourceful for a given person.
Right. So it's like a self-directed process, right, where they scan for whichever objects feel right, and then kind of start from there to kind of build up this sense of self.
Yeah, so that's how we start. I mean, there's lots of ways in, but like that's how we start. But just getting the person sort of oriented towards something that's resourceful, and they might it might be a photograph, and then they talk about like this trip they went on, and then what was so great about this trip, and the person they went on it with was like an uncle, and this uncle, and they kind of just start talking, and then you are like, with your own like heightened body awareness as a meditator, you are like feeling into like what they're saying, and you're going to notice that there's going to be certain moments when they just feel like alive. Like you can just see it in their organism. It's just like it's beaming. It's like, ooh, the uncle's really important. Let's go back to the uncle. It's not really about the trip. It's not about the sunset that's actually in the photo. It's about the uncle. Like, tell me about the uncle, and then you can start to see, and they start
Right.
moving differently. And then you can be like, they'll be like, what's up with your uncle? And they're like, he's so straight, and you're like, what's up? What's going on with that hand right there? And then they're like, oh yeah, like that feels really different. So to some extent, you're just following them, but also like mirroring back to them, like the places where you're seeing um their own positive reactions to certain things that they're saying. So
Right.
I'm very much not leading someone or like giving them suggestions. But I'm also like making sure that they're, not going so fast through something that they're missing all these moments. So it's
Right.
very cool. And just, yeah, I think we have a scaffolding workshop. And even to just be in the room when someone else is getting scaffolded, because we have observers come. It's just everyone just feels much better at the end.
And what kinds of starting point are people coming from with this process? Because, I know disturbances in affect or kind of feeling emotion is a big thing that you see. Is it that someone has kind of deconstructed their inner world in a way where they're struggling to orient towards the meaning in a way where you as the outside observer can see the glimmer of like, well, you seem to be interested in that object, and let me guide you back to know how to read these signals for yourself.
So what kind of mental state are they in the
Yeah,
beginning?
exactly. For someone who finds it easy to kind of read their inner world and to navigate towards meaningful objects in their environment, I think the implication is that there's some deficit or some damage has been done or there's been some change in that capacity. Is that
I mean, in a generic way, like, often these are meditators who relied on meditation to be their main resource and refuge and sense of meaning and sense of like method for kind of regulating their emotions and nervous system. And then something happens and it's no longer available. In fact, it's like almost a traumatic trigger. And so then they're like, now what do I do?
right?
They feel really kind of, I mean, when you have meditation as it's like a friend. It's like having a friend, and then having that, then finding out that your friend slept with your wife or something. It's like, oh my God, like what am I going to do now? Like I don't have that friend anymore. And so that's where we're like, let's start. So, we'll help people find resources that are immediately
Right.
available to them, already actually existing inside them. So that's like sort of the most generic case was just like meditation is no longer available. But I specialize in dissociation where people are like they're like I don't feel anything anymore. I feel nothing. And so to some extent scaffolding is like it's like a CBT kind of like let me show you that your amygdala is actually working just fine because you ask them like look around right now and just like find something in your environment that's meaningful to you. And they're like, okay, like within, I was like, that took like 30 seconds or less than 30 seconds. Like, I thought you didn't feel anything. So it's just like, it's a really good way to point out that like, your amygdala is maybe not the signal's not as loud, but it's still there.
Right.
And that's kind of like a really important thing to realize.
Yeah, it's interesting how the meaning making part of it, the sort of kind of the sense of leaning into what's meaningful, is interesting to counterbalance with kind of deconstructive no self type meditation stuff. So if you imagine someone has a dog on their lap and they're stroking it, so in certain frameworks, the aim of practice could be to get to a place where you are only feeling sensations. You're not feeling meaning or attachment. There's just the fuzzy feeling of the fur. There's no warmth of attachment to the dog. There's that could be called equanimity. There's just a very placid sensory sensations are arising, and that could be someone's goal. But then someone who ends up moving in that direction where they don't want to could then say, well, actually, yeah, I don't want to lose attachment to my dog. That's a source of meaning. And so instead of a loss of meaning being liberating and leading to equanimity, they may decide to move back in the direction of re-engaging those relationships of meaning. And then someone in your situation, maybe they look at the dog in a certain way and you could invite them to say, oh, you seem to be, you just smiled at the dog, right? Is that something we could lean into?
Exactly.
Does it feel like a kind of, to me, these two things feel like the two skill sets that, again, just two ways to explore experience, and people should follow what feels right for them. And because I guess I'm leaning towards saying they could be seen as counterbalancing, but it doesn't really feel to me like they're warring against each other. It just feels like two different practices one could engage in.
Yeah. I mean, I think that, if you take the sort of meta perspective that there are experiences and there are lots of different interpretations of those experiences, and there's lots of different experience, like different ideas about which experiences are valuable or even indicative of some kind of ultimate truth. If you can acknowledge that there are, that's contested, that's a contested area, then we can then it kind of by logic, the person whose experience it is gets a vote. But that's often not the place that people are coming from. People are often coming from that there is a truth, there's one truth, and this is what you have to do to go there. And any deviation from the path or any sense that you don't like it, you just need to get over yourself. So there's also kind of a no pain, no gain, like more um, straight line, less person-centered approach. And like, to be fair, like sort of religions by definition are like not person-centered. You're not
Right.
like, I'm going to meditate. I think there's six noble truths, Like, no. Like
Yeah.
you don't get to improvise. Like there's the truths are already out there, like are already decided, and like you can decide to participate or not. You don't get to necessarily like have your own experience. So I think that's where it gets really confusing because I think that in the West, a lot of meditation is being kind of marketed as like you can take this tool and do what you want with it, and like you get to have a choice and autonomy about like what well-being looks like to you. And then once you get into the system, there's a lot of preset decisions that are already made for you. So I think that that's a place where something needs to change, where or I mean there already are systems where that like Insight Timer, for example, is just like this clearinghouse of different practices and ideas, and like people can kind of pick and choose what they want and where they want to go. And um it's there's just so many different choices that there couldn't possibly be one way.
Right. Yeah.
I don't know if that
Yeah.
makes sense.
No, definitely, and it's interesting. Yeah, what you say about organized religion, because yeah, you don't get to choose. Actually, I think maybe Judas was the Messiah. If you're a Christian, like that's seen as a heresy rather than as something that you're allowed to do if that feels right to you. Whereas I think there's an interesting spectrum where something like Tibetan Buddhism, which has a more direct line to kind of shamanic practices, there does seem to be more like there's these visualization guru yoga practices that I mean I don't know, I'm not an expert in this stuff, but I see more room there for more person centered exploration. But yeah, I think just knowing that these things are always at play and not giving over your autonomy unconsciously and just thinking, I've been told this is the one truth. I'm going to completely just trust this institution or this tradition, especially as you say that people who have been traumatized and have been harmed by people in authority may be more likely out of that kind of trauma fear response rate to follow that kind of path. So I think being aware that this stuff is at play is crucial.
Yep. I mean, I think that, just to sort of expand what you just said is like this sort of the orientation that I'm about to describe could be a result of trauma, but it could also just be a way of orienting. And so, we've in the varieties of a contemplative experience study, when we looked at predictors of, duration or severity of, disability, we expected to see, psychiatric and trauma history as predictors, and which did not seem to play out. But what did seem to be a fairly consistent predictor was sort of in some ways almost the opposite, where like 75% of our sample had doctorate degrees, JDs, MDs, PhDs, CEOs of major, Fortune 500 companies. 60% of them were meditation teachers themselves. And so we started to realize, and for a while we were sort of scratching our heads, but like we started to realize that being high achieving itself was a risk factor. And we're like, well, how could that be? But it like dovetails with the trauma response, which is that if you're one of those people that is like sort of trained to look around and be like, okay, what are the social expectations here? Like, how do I like get an A in this situation? How do I get an A in this family? And like we figure out like how to ace the test. And those are the people that end up getting PhDs and JDs, and because they're really, really good they're very attuned to what the expectations are and then like how to ace them. But that might come at the expense of knowing what your own internal compass is. And so it's interesting that like, yeah, that high achieving thing can be kind of a a double-edged sword. I speak from experience, by
Right.
the way.
Yeah. Yeah. And so in documenting these, I mean, this idea, right, of impairment in functioning is that how you typically define uh, these challenges?
So, I mean, because the experience itself, um, kind of while it's happening, can vary in valence. Like it can go back and forth. It can be in different valences. We use the word challenge, but in terms of, using the word adverse effects, which has to be used at some point, I tend to, you know, the definition of adverse effect tends to be, even if you look at the World Health Organization definition, it's like still really vague. It's like lasting bad effects, or lasting disability. And it's like, well, what's lasting? Like, is lasting like the day after you get off the cushion? Is like a day lasting, or does it need to be like a year? And so, and then what is like disability? Does that mean that like you can't drive home from the retreat because you're too like out of it? Or does that mean you can't go to work for like a month, or like that you end up in the psych ward? So I think like, I have taken a conservative sort of like guess at that based on what you see with, similar types of choices around like when does sadness become depression? But they're like, well, if you have it every day, more days than not, for 2 weeks, then, and you also have these other things that go with it, and it's, it's distressing and impairing and functioning, then it's depressing. So my cutoff was a month. So basically, if you're having something that lasts a month and it's impairing your ability to function, then that's sort of like that crosses the line into adverse effect.
Right.
But again, like you got to ask the person who is having the experience, because sometimes they're like, I can't tolerate, you know, an adverse effect is anything that deviates from what was advertised, which was like awesomeness, you know?
Yeah.
Awesomeness on every front, and I'm not getting awesomeness on every front. And so that's an adverse effect. I mean, technically that's a side effect, is anything that deviates from the packaging.
Right. Right. Yeah, I think that's a really good way of thinking about how to explore this stuff. And so you have online, if people want to look in more detail, this taxonomy of 59 different categories of kind of impairments and functioning, right? That can appear. Maybe you could just briefly outline the sub organized right into different sections.
Oh, the 59 categories?
Yeah.
Oh boy, this is like the pop
I've
quiz.
written them down. If I don't mean to test you, but it's
So
interesting for
I mean, I
people.
know there's seven different domains. So we
Yes.
have like the cognitive domain. So those are things like, anything that sort of messes with your thinking. So it could be, racing thoughts, obsessive thoughts, delusions, um, loss of all thought altogether, mind emptiness. Um, and then problems with like memory and executive function. So that those would be like sort of the most common cognitive ones. Then perceptual, so anything that affects your sensory perceptual systems. Um, Sensory hypersensitivity is probably one of the most common, and a really good example of when something can switch valence really quickly. So like, one of the coolest changes that happens, and one of the fastest things that happens, in meditation, is it doesn't take very long to like you get a little bit concentrated and you open your eyes and like everything's brighter, right? Like everything, or like it's crisper or clearer. Like that doesn't take very long. And it's kind of cool. So it's a positive valence experience. But when it goes to be like when you start hearing like the ticking of the clock and it just gets louder and louder and louder, like that can start to become like a little worrying. Or if you go from one place that's quiet and to a louder place, then it can be like completely overwhelming. So a really good example of like the experience itself isn't naturally inherently good or bad. It's like very contextually, based. Um, Hallucinations goes with the perceptual one. Um, then there are like a whole bunch of somatic ones, which are basically anything to do with the body. So that would include like changes in appetite, changes in sleep, lots of else's, which is energy like somatic experiences, which is a term we had to coin because it doesn't really exist in sort of scientific literature, but it's actually pretty common in the meditation literature and also causes a lot of concern because people just don't know what it is. And a lot of the teachers don't know what it is, like what to do about it either. Um, so also pain conditions can go in the body, lots of weird sensations and vibrations and pain. Um, and then sense of self, which is my favorite domain, lots of different changes in sense of self. We wrote an entire paper on, I think there's like 6 or 7 different types of senses of self that can change in different ways. Again, all of them can be, positive or negative or a combination depending on lots of different factors. Um, I don't know, what am I missing? There's a couple more.
There was affective, social, and then motivational cognitive, which was not a word I'd seen before.
Right. So that one's is kind of a small category. It's basically like people can kind of lose all motivation and be like, whatever. And I've seen people who are like, I stared at a wall for 2 years because I was like, why do anything? Like,
Right.
why not depressed? I just like, there's no reason to do this rather than that. Like, this is going to be the same as that. That's one of the sort of side effects of equanimity. If there are no preferences, there are
Right.
no choice is better than another. So why like do anything? So that's like the sort of a motivation. And then the opposite, which is, you know, oh my God, enlightenment is real. Like I'm leaving my family and shaving my head and like I'm on a bus to, to India. So there's also the opposite of a motivation, was sort of like hyper motivation. Um, Affective was basically just emotions, and we see like kind of every possible emotional pattern. So we see like, intense fear and terror and anxiety, and that's most actually the most common is something in the fear domain. But also like grief, rage, um, joy, euphoria, grandiosity, mania, but also like complete lack of emotions altogether. So, and those things can appear in the same person at different fluctuations in their experience. So,
Right.
oh, and then also, yeah, flooding, or traumatic re-experiencing is also a pretty common experience in the affective domain.
Right.
Yeah.
Yeah, and those are online, right? If people want to look in more details at the 59 different categories, they can find out. I think it's on the Cheetah House website.
Yep, Cheetah House website under symptoms, and then also all of the papers, the original research papers that these come out of are on my Brown University Clinical and Affective Neuroscience Lab website under publications. They're all up there.
Great. I'll put links to those in the descriptions. Yeah, and thank you so much for your time. This has been great.
Great.
Thanks for listening. If you're watching on YouTube, please like and subscribe. And if you want to help the podcast reach a wider audience, you can leave a review on Apple Podcasts. Finally, if you want to offer financial support, you can go to patreon.com/Dr. James Cook.